Good afternoon, everybody. It is Doc Swiner back for your Medical Minutes Lunch and Learn on this Monday. Happy beginning of a new week. Hopefully you're doing well. Give you a couple of moments to log in if you have time. Don't know if you're on your lunch break or taking a quick walk. Kind of rainy and gloomy outside here in North Carolina. But hopefully you're getting some fresh air and taking a little bit of a break from your work day. It's nice to see you. Hi, Ebony. Nice to see you. All right, if you are joining us for the first time, I am Dr. Nicole Swiner, otherwise known as Doc or Doc Swiner, and I do and have been doing a live streaming series for a number of years called Medical Minutes, both with friends of mine and solo to talk about the bread and butter medical topics or wellness topics that I like to talk about most when I'm out teaching or speaking or writing. When it comes to general medicine, family medicine, mental health topics, pediatrics, all that good stuff, taking care of the family as a whole. And that's what I do. That's my background as a family doctor. And I write and talk about many of those things that affect us as particularly as Black folks, as women, who are aging gracefully and trying to live longer, more quality lives. So that's what I like to do. And I like to, every couple of months, I'll do a couple of weeks in a row of these. And I have them saved on my YouTube channel and my Instagram here and Facebook and LinkedIn and all that good stuff. But I have them all collected so that you can go back and listen to them and then have those questions and take them back to your primary care providers and have those conversations about your health or make those lifestyle changes that will hopefully help to prevent some long-term complications and chronic medical issues that we all deal with as we get older. So, welcome. If this is your first time seeing me, today we're talking all about high blood pressure, which is one of my most favorite topics because it relates to almost all the organs in the body. There are so many ways that we can hopefully treat it naturally, hopefully prevent problems with it, because as we probably know, if you're not treating your high blood pressure, if you're not paying attention to it, not watching your diet, not exercising, not taking your medication, if you're already on medicines, then it can lead to kidney issues. It can lead to stroke, to heart attack, to blindness, to vascular issues of your extremities and loss of limbs and all these horrible things. The good news is it is treatable and it's even preventable. So if you can do your job, the more you know, right? The rainbow. The more you know, hopefully you can get ahead of that stuff. So this is what we're going to talk about. We're going to jump right in. I'm not going to start from, the beginning of history because I know all of you, most of you all should know a little bit about blood pressure and how the body works and how high blood pressure is diagnosed. If you are, going to the doctor and getting your regular checkups and going to the dentist now, they're even checking your blood pressure at the dentist, then you know how blood pressure is checked. It's checked with a cuff, right? Long word that begins with an S, and for my my spelling bee people, I'm not even gonna try to say it, but you know what it is, right? So we get the blood pressure cuff. You can even have some at home. The older you get, the more important it is to have one of your own, just to kind of check your blood pressure once in a while. But they pump it up, and they pump it up usually here in the what we call the antecubital fossa, right above the elbow. Some places or some people do check it on the wrist. I don't necessarily like that because the farther away you get from your heart, the less accurate a blood pressure check is because of the blood vessels. But if that's all you have, that's all you have. And you can kind of take a couple of points off when you check it with the wrist. And usually at the dentist, they do that with the wrist, which I don't always like. And then when you're at the dentist, I'm like, well, of course your blood pressure is going to be high. Like, nobody really wants to go to the dentist. I digress. Okay, so we take the blood pressure at the antecubital fossa, where a lot of your veins are present and prominent. Get that top number, that bottom number. The top number is systolic. Bottom number is diastolic. Side note, I talk a lot about blood pressure in my upcoming book, The Healthy Kidney Handbook. Is coming out next year. I have a whole chapter dedicated to it, and so a lot of this stuff will also be in there. However, checking your blood pressure, very important. I would say clearly once a year when you're going for your annual physical, it's very important. Even more important if you know that you've been stressed or you feel like you've had a lot of really bad headaches or feeling extra fatigued or you've had a lot of tension lately, check it even more often. Numbness and tingling in your extremities, check it more often. But 120 over 80, generally speaking, is kind of the norm, right? I think the CDC says that is normal blood pressure. Anything above that, before you get to like 130 on the top and you're systolic, or 140 on the top, depending on who you read, and then anywhere between 80 to 90 or 85, depending on who you read on the bottom, diastolic, is pre-hypertension. So if you joined me last week, we talked about diabetes. Just like diabetes has a pre-diabetic range where there's this, like this, red flag area, so does hypertension have that. And so you want to try to catch things early if you can, because it's treatable, like I said. So between 120 to 130 on the bottom, 80 over or 80 to 85 or 80 to 90, pre-hypertensive state, you want to really get focused and try to get things in order. Hi, Season Tickensai, my new friends. Nice to see y'all. Above that, however, is generally in the hypertensive range. And there are stages, just like there are stages to kidney disease and all over, a lot of other types of diseases, there are stages. But generally, anything above 130 over 80, depending on who you read, 130 over 80 or 130 over 90 is generally understood. The JNC8 is a committee that does a lot of work on hypertension. They consider that to be hypertension for most people. 140 over 90 or 150 over 90 all depend on your age range, all depend on what medical history you have. If you have disease like known heart disease, kidney disease, diabetes, those, the lower numbers are better because we want to keep you out of those ranges. If you're older, we want your blood pressure to be a little bit on the higher side, because the lower your pressure is, the more likely it is for you to not be getting good circulation and feeling dizzy. All kinds of nuances. Long story short, anything above, I would say, 120 over 80 on a regular basis, you want to go in and have a conversation with your doctor, okay? So those are your numbers. Your systolic over diastolic. In most cases, 120 over 80, 130 over 80, essentially considered normal. But if you're above those levels on a regular basis, even if you are in a stressful situation or you're in pain, like I said, you're at the dentist and you're stressed out, if your blood pressure is elevated on a more regular basis, they're going to tell you, hey, go check in with your primary care because there could be an issue. Okay, so let's say that you are pre-hypertensive. Okay, so you're pre-hypertensive, you're otherwise feeling good, feeling healthy, not on medications. If you focus and exercise regularly, and we'll talk about what regularly means, quit smoking and other substances that can cause your blood pressure to rise, de-stress, sleep better, right? So not just sleep longer, but sleep better. It is possible to get those numbers down. So let's talk about natural ways that you can get your blood pressure down, okay? Before medications, or even if you're, say, on one medication, let's say you're on one small dose of hydrochlorothiazide and your goal is to get off of that, what are some other ways you can also be helping your blood pressure to decrease? One thing I talk about in the chapter in my upcoming book on the kidney is exercise. Regular exercise, is defined as 150 minutes per week. You've heard me say that if you've listened to some of the other medical minutes that I've done. 150 minutes per week means 30 minutes for 5 days. It means, right, my math is right? Yeah, it means 50 minutes for 3 days. You can chop it up and divide it up however you want, but 150 minutes per week is regular aerobic exercise. So that's outside of your weightlifting. That's cardiovascular, getting that heart rate up, getting your breath to speed up, getting perspiration on your brow. That really is good for your heart and for your blood pressure and for all the other things in the body. De-stressing. If you have a stressful job, if you're in a stressful relationship, if you're going through a stressful situation, de-stressing, whatever that looks like to you in healthy ways, getting your stress level helps with that, helps with bringing your blood pressure down. As you can imagine, blood pressure is generally caused by your blood vessels tightening or constricting, right? Being tense, being tight. Anything that can relax and dilate and open up those things, helpful. So if you de-stress by doing yoga, this is a lot of deep breathing. If you de-stress by going outside and taking a quick walk to get some fresh air, by stretching, by moving your muscles around your neck, by doing anything that decreases your stress hormone, which is cortisol. That's the main one. Anything that decreases your cortisol level helps with decreasing your blood pressure. And within minutes to hours, you'll notice a difference. So I just read up before I hopped on here, exercise, within 30 minutes of finishing, you can decrease your blood pressure anywhere from 5 to 10 whole points. Can you imagine? So let's say you're at that 150 range, you have a really bad headache, blurry vision, etc. Go outside for a brisk walk for a couple of moments, come back in, check your blood pressure, and it's down to 140 or 139. Hopefully you feel better and you can keep that maintained, right? But it's with consistently too. You can't just do one-offs and expect for your pressure to stay down. You have to do that consistently. Quitting smoking. Nicotine is a huge vasoconstrictor. Over time, it dilates, and that's why people feel that relaxation. But it also vasoconstricts. It causes constriction and tightening of your blood vessels. It's harder for your blood flow to get to where it needs to go. That means it has to push harder against more pressure. That's what causes the hypertension. So quitting smoking also will help with that, okay? Hey, Butterfly Poe, hello. Sleep is one of my favorite topics to talk about. The more you sleep, hopefully also the more quality sleep you have, allows your body and all the blood vessels, all the soft tissue, all the muscles. Your heart is a huge muscle, allows things to relax. Your blood vessels, your arteries and veins are surrounded by smooth muscle. They relax. You have a better chance of your body recuperating for the next day, lower cortisol, lower blood pressure. See how all these things are connected, right? So better and longer sleep. Just because you're sleeping 10 hours, if you have things like obstructive sleep apnea or things that are getting in the way of good sleep, or you're having too many cocktails before bedtime, you're not getting restful quality sleep, then that's not good sleep. Good sleep is 6 to 8 solid hours, good oxygen flow, good breathing, nice relaxed state, right? It's not getting up and down to go use the bathroom every 2 to 3 hours. It's not waking up in a fit because you feel like you can't breathe. It's good quality sleep. So if something is affecting your sleep, then you also need to address that so that you can have good quality sleep consistently, better blood pressure, okay? You all feel free. I see a lot of my friends popping up here in the messages. Y'all feel free to ask any questions specifically if you have them, or you can DM me later if you have questions of your own personal matter. And as always, never forget the disclaimer. All of this stuff, you definitely need to be checking in with your primary care provider before you make decisions for your own personal health history, or if you have medications or things that you want to adjust and change. Don't do anything until you talk to your primary care provider, okay? You can say that Dr. Swiner said it, but don't make any of those changes before you talk to them. I want you to be, it's a team effort, right? So you take things that you've learned, things that you've read, back to your primary care, and then you all make the decision together, all right? So, natural things. Other natural things that you may have read about or your grandma may have told you about include supplements. Supplements like cinnamon, ginger, garlic, apple cider vinegar. I know you've seen a lot of things on these supplements and on these organic natural remedies. They do work. It depends on who you are and how much you take and how consistent you are with them. That determines how well they work. But in general, when you read the studies, anywhere between 2 to 5 points of a drop can be seen with regular use of these things. Now, that does not mean stop your losartan and switch to cinnamon. That doesn't mean that. That doesn't mean continue smoking, not sleeping, don't exercise, and rely on garlic. That means together, right? So, is it possible that taking cinnamon on a regular basis, your 150 minutes of exercise per week, your better sleep, and your losartan, does that mean at some point that you can stop your losartan? Absolutely, with the help and the permission of your medical provider, if your blood pressure stays and remains normal. Okay, so I have had a lot of folks come to me in the clinical setting and say, okay, I'm on these 2 medicines, I I hate having to take the medicine. I hate having to pay for this medicine every month. I want my body to be able to naturally regulate its own blood pressure, its own whatever. How do I get off? I say, okay, what's your plan? Are you doing the work? Are you decreasing your sodium? Have you been able to drop 5 to 10% of your weight? Are you able to do that by doing the other natural or the other lifestyle changes? If we can do that, and you come in the office or you're checking your blood pressure and documenting at home, that every time you check your pressure, it's 100/80, then we absolutely can start to taper. We can wean. I won't just snatch you all the way off, right? You don't want to have a huge rebound of your blood pressure because you snatch someone off their medicine too quickly. But if they're on a medication that's 25 milligrams, over time they're checking the pressure, they're doing the work, they're watching their sodium, they're exercising regularly, they cut back on smoking, we cut the dose in half. See how you do in the next couple of months. You're checking your pressures at home. Now it's 112/80. Still doing great. You're taking half the dose, but you're still doing your supplements, your sleep, cutting back on smoking, exercising. Then we come off. Like there's a method to the madness, but it can be done. It can be done. Okay. Same with diabetes. Talked about it last week. If you're doing the work, doing all the other things you're supposed to do, which we all have a problem with, being consistent with the stuff that we know we're supposed to be doing. But if you're really doing it and you're focused and you're saying this year, I'm going to get off medication, it can be done with the help of your medical providers, okay? All right, so let's see. So we talked about what blood pressure is, how it even works, how we measure it, why it happens. We talked about what organs are generally affected. Anything that has muscle, right? So your blood vessels, your heart, the muscles in your body, right? The main muscles that hold up your body become tense or they relax and they can cause your blood pressure to either go up, go down. We talked about some natural remedies. We talked about tapering and weaning off of medication with the help of medical providers. Massage. Let's talk about massage. That can be one of the things that you include in your lifestyle change when it comes to decreasing your muscle tension, decreasing your stress level, decreasing your cortisol. There are studies that have shown that within minutes of finishing a 60-minute or so Swedish massage, not deep tissue, which are my favorite, Swedish, the relaxing kind of massage, because deep tissue can be really painful and it can almost cause more tension, but it feels so good. But within a couple of minutes of doing your Swedish massages, you can see, again, depending on who you read, anywhere between, don't get me wrong, 6 to 8 points. I might actually, let me double check that. 6 to 8 point drop, I got my notes here, in your blood pressure, and that can last for a couple of hours after doing your massage. It's almost like doing a cardiovascular workout. It's equivalent to that. Isn't that wonderful? By just laying down and letting somebody remove the tension from those muscles, remove the lactic acid buildup in your body. And then you go and you flush and you drink a lot of water and get it out of your system. Decreasing your blood pressure is another benefit. Isn't that wonderful? If I am on my usual routine, we're usually getting our massages. We usually get 90 minutes, me and my husband, at least once a month. If we're doing good, sometimes twice a month. I really do credit that as a big deal when it comes to keeping my blood pressure low. Thankfully, knock on wood, my blood pressure has remained low. I've never had to be on medications. My goal to never have to take medication. I think, and I credit it to a de-stress lifestyle. I de-stress. I go to sleep. I get my good 8 to 10 hours, 8 average. Try to exercise as consistently as I can. At least one good, really good cardiovascular workout, whether it's Pilates or step aerobics, which I'm going to tonight, plus some other days where I'm on the treadmill or on the bike. I don't smoke, drink moderately, but I try not to overdo it, and then massage. I think those are a big deal, right? We do what we can. All of us have a lot of folks in our family that have high blood pressure, myself included. I'm trying to fight it. Let me see. I just want to make sure I say that right about the massage and its effect. One study noted, this is for Swedish and deep tissue. I take that back. Swedish and deep tissue massage does help too. One study said a reduction of 10-point drop. The other said, and that was in your systolic, the top number, and the bottom number about 5 points. That's not insignificant. That's not insignificant. That's a big deal. And it can last for hours after getting the massage. That's a big deal. So just imagine doing that consistently makes a big difference, right? So if you're walking around stressed out, eating all the salt, smoking the cigarettes, doing all the things, not sleeping, grind till you can't grind anymore, walking around at 160 over 90 every day, your heart's taking a hit, your eyes are taking a hit, your kidneys are taking a hit, your circulation's taking a hit. On those times where you can go and sit and relax and get a massage, or sit and have deep breaths, sit and do yoga, take a nap. Any time when your body is ready or allowed to relax and de-stress and have those blood vessels relax and not be constricted are minutes that your organs have time to recover. Your brain, right? Anytime is good. So if you can add in those minutes and you get those minutes add up over time, then that's a big deal. Okay? All right, what else should we talk about? I'm going to probably jump to hey, Miss Sherry, I see you. Hi, Cornelius, hello. I'm going to jump to the medications in a minute. There are many, and I'm sure you're familiar with them, right? Things that we use to treat blood pressure and how they work. We'll jump to that in a minute. But, oh no, you can't hear me? Can anyone else hear me? I see hearts. I assume that meant y'all could hear me. Let me know if you can't hear me. I'm sorry. I hope I haven't been talking this whole time and y'all couldn't hear me. All right, let me know. Shoot me a text. Okay, you can hear me? All right, she can hear me. Portia can hear me. I'm sorry, Miss Sherry. I'll post the recording later so you can hear me. Let's talk about medications. Actually, now that y'all are here active in the chat, throw out some of those most familiar medication names that you know of for high blood pressure. There are many. And I go through this also in the chapter that I'm writing for the kidney book. All the wonderful categories of medications. We hope that we don't have to treat you with medicines, but if we need them, we got them. We got you covered. All right. Hey, Dirt Jers, good to see you. All right, so I'm going to start it off. Most familiar, usually the first thing we start with, first line, diuretics, right? Your water pills. Your HCTZs, which stands for hydrochlorothiazide, your any of those things that can cause your body to release water. Hydrochlorothiazide's the most common one, is usually number one. Hi, Mr. Darius. All right, so diuretics, he said A. Diuretics not only help with decreasing the amount of water that you may be holding on to, but it helps with the balance of sodium and water in the kidney, and that's how it decreases your blood pressure. All right, so diuretics. Your ACEs and your ARBs, your ACE inhibitors and your ARBs, right? Okay, good. Miss Sherry said she can hear me now. Great. So your ACE inhibitors like lisinopril, enalapril, captopril, the prils, you've heard of the prils. And your ARBs are your Artans, losartan, valsartan, olmesartan, right? Those are all the generic names. The brand names are all different. Excuse me. The ACE inhibitors and the ARBs work primarily in the kidney and have to do with, there's a whole, and if you look it up online, you get my book coming out next year, there's a whole graph that shows angiotensin 1, angiotensin 2. It's like Dr. Wooten's on here, so she's probably triggered by me saying those names, remembering all the graphs and things that we had to remember. But long story short, bradykinin, angiotensin, these are things that are created within the kidney and the adrenal glands that have to be balanced so that our blood pressure can be maintained. Right? She's laughing. Yes. If you have too much angiotensin, then your blood pressure goes up. ACE inhibitors, the first word of the A in the CE is angiotensin, right? ARBs, angiotensin receptor blockers, decreases that so your blood pressure stays low. That's how they work. Okay. Beta blockers. Who knows about beta blockers? Your metoprolol, your low pressors, give me another one, atenolols, your Tenormins, your It's all coming back. What else? Labetalol. That's a good one. We use that in pregnancy a lot. Beta blockers have to do with your heart rate and the smooth muscle of the heart. And that is how they decrease blood pressure, essentially. Right? Propranolol. You got it, Kendra. You got it, Dr. Wooten. Decreasing your heart rate, relaxing the smooth muscle. Okay? That's how beta blockers work. So they don't really help with water. You know, if you're retaining water or you feel like you have swelling and edema, either related to or unrelated to your blood pressure, then the ACE inhibitors and the beta blockers aren't really going to work. It's going to be your diuretics. Your diuresis means to urinate out. That's what's going to help. Sometimes you might have to do a combo, and they all generally come in combos. So you can get your losartan with an HCTZ or your metoprolol with an HCTZ, and you kind of combine the effects that you need to help keep your blood pressure down and the effects of blood pressure as well. We also use these meds, particularly beta blockers. We use these meds for a lot of other things other than just blood pressure. So for instance, Dr. Wooten mentioned propranolol here in the chat. Propranolol we also use to help with things like tremors or shakes, because again, they help to relax muscle. So, you know, for people who have a lot of tension headaches, the muscles are really tense and they have tension headaches, or they have performance anxiety. A lot of surgeons, right? She says anxiety, very good. So a lot of surgeons, before they enter the OR, may take propranolol, or may help with flying if you have fear. So a lot of these medicines later on, like most medicines, you then notice, oh, it helps something else. So then we use it off-label, or later it gets an FDA approval for another reason. So that's beta blockers. All right, calcium channel blockers. Okay, those are, running my brain today. Let's see. Calcium channel blockers are nifedipine. Oh, it's coming to me. Nifedipine. Dr. Wooten, you got my back. Nifedipine is the big one. Cardia. What else? Yep, amlodipine. You got it. So they're the peens, right? They also can help with the balance of different, clearly, calcium, right? Calcium, they also help with relaxation of the blood vessels. A lot of people take those for headaches as well. Some people take them for anxiety as well, because they help kind of relax things, okay? And again, these medicines are often used in combination with one another for different reasons. What else? ACE, or alpha blockers, they're kind of the OGs. They kind of, again, make sure I gotta get my info right. I gotta go back to my chapter. Alpha blockers, you may have heard of, methyl-dopa, not used as often nowadays, because we now have other medicines that tend to work a little bit better and have less side effects. But alpha blockers are still out there. We also use it for anxiety. It's interesting that a lot of these medicines that treat blood pressure, we also can use for anxiety. Isn't that interesting how the two relate? But a lot of these medicines you may have heard of being used like back in the olden times, or for people who have a lot of allergies and can't tolerate the diuretics, or have kidney issues and can't take a water pill, or are allergic to ACE inhibitors because it gave them that cough, right? That ACE inhibitor cough that can happen with some people, or the swelling that can happen, the angioedema that can happen with some of the ACE inhibitors or ARBs. Have to rely on some of the older school ones, but we still have them. They still exist. We just don't use them as often, or we use them more for other reasons. Okay, what else? Diuretics, ACEs, alpha blocker, beta blocker, calcium channel blockers. What else? What did I forget, Dr. Wooten? Dr. Wooten, I'm just going to have you on here next so you can just help me remember things. That's also why I take notes. Let's see. We talked about the natural stuff. I'm looking back at my chat. Clonidine is one of my favorites. Yes, clonidine is great for, I used to use clonidine a lot for behavior issues, for children that had behavior issues, which kind of masked, anxiety or needed help with sleep. Clonidine is a good one. Yes. Let me go back and see. Minoxidil, which you may know of in hair formulations. Minoxidil is used topically for people with hair loss. it actually is a blood pressure medicine. It started out as a blood pressure medicine, which is why you have to be careful with some people that have maybe low blood pressure. You don't want to use too much minoxidil because it can lower the blood pressure even more. But it started out as a blood pressure medicine. Later they noticed, oh, look, people are growing hair. That's how they came up with it, right? That's how most of these things work. All right, let me make sure I'm not missing anything. ACEs we talked about, calcium channel blockers. Prazosin, I was going to say clonidine, as Dr. Rutin pointed out, is an alpha blocker. Again, one of those older school ones. Flomax, interestingly, we use for the prostate. The name is tamsulosin. That's the generic name. Started out as an alpha blocker, blood pressure medicine. We later realized, oh, look, it helps to relax people's prostates and help them to urinate better and helps with enlarged prostates, right? Yeah, we talked about diuretics earlier. And then some of the atypical ones, like I mentioned, minoxidil, also called Rogaine, started out as a blood pressure medicine. Now we use that for hair growth. Hydralazine is a good one. We use that a lot in pregnancy. Hydralazine and labetalol are medicines that you may not hear of a lot kind of in the mainstream, but we use them a lot in labetalol, Lopressor, things of that nature. We use it in pregnancy because they're safer for the baby, or safer when you are breastfeeding, things of that nature. We don't want to cause toxicity to the baby. So those medicines we tend to use on that side. Or if you have really significant kidney disease and can't tolerate some of the other medicines, because they can, unfortunately, some of them can cause your creatinine, which is the way we measure your kidney function, to increase either for a short time or over time, then some of the other either old school or some of the more atypical medications we'll use on that end. So what does this mean? There are a whole lot of medicines we can put you on, but the goal is for you to never have to use medication. Or if you're on medicine, the goal is for always for you to get off. And there are ways that you can do that if you're really committed, really dedicated, and work side by side with your primary care and your medical provider. So you can do it. You just got to be serious about it. Okay? All right. Any questions for me? I threw all of that at y'all in 30 minutes. So make sure you're checking your blood pressure regularly, no matter how healthy you think you are. The older you get, the more important it is. If you have a blood pressure cuff at home or you're looking for one at home, get one that fits around the elbow. That's my recommendation, your elbow versus around your wrist, because I think it's more accurate. Check your blood pressure. If you are, consistently above 120 or over 80 on a regular basis, check in with your physician. Decrease your salt, your sodium intake. I see your question, Sharon. I'll answer it. Decrease your salt and sodium intake. That means decreasing your potato chips, your snacks, your packaged meats, your crackers with a lot of salt. Decrease your salt, your meat that is preserved in a lot of salt, your canned goods that unfortunately have a lot of salt. Take your salt shaker off your kitchen table, right? Use your salt substitutes, which have more potassium than sodium, right? If you're doing all that, it is possible. Sharon asks, what is amlodipine? How will that work with lisinopril? So amlodipine, Miss Sharon, I don't know how much of the earlier part of the conversation you caught, but if you rewind a little bit, amlodipine is one of the calcium channel blockers, so it helps with reducing calcium and relaxing your blood vessels. Lisinopril works within the kidney. If you combine the two, you get really good blood pressure control, depending on how you tolerate it. Yes, Darius, decrease potato chips. If you're really trying to, unless you do the baked ones, you can do your baked. But that has sodium in it too. You got to, turn the bag around and look at the label. It'll tell you how much sodium you should have in it. Here's a pop quiz. How much sodium per day, milligrams, should we limit ourselves to in general? And then especially if you're watching your blood pressure, what's the answer? Sharon says, well, I just grabbed some sandwich crackers. I know. I'm probably about to grab some upstairs too. But I am going to step aerobics tonight, so I'm going to work it off. All right. All right. About the answer, let's see. See if somebody's going to... Nope. 25 grams. Is that right? About 2,000 milligrams. 2,000 milligrams, right? So I say it matches up with the years. 2024, about 2,000 milligrams of salt per day. is what we all should be focused on staying under. So read your labels. It will tell you how much sodium is in each thing that you're eating. The fresher the food, the better, because if you buy a lot of things that are already pre-packaged, pre-preserved, they use salt to keep things for longer. That's why salt was created. It's a great preserve, but it's not good for the body. Good. Sharon said, just finished walking. Very good. Very good. All right, my folks, so I'm going to keep this recording on my timeline. I'm going to keep it in my Instagram reels. I'm also going to keep it on my YouTube channel, youtube.com/DocSwiner. Got a lot of things coming up. Keep up with us. Right, 2 grams, not 25 grams. So got a lot of things coming up for the end of this month. Come and see us at Prevailing Pilates Anniversary, the last week of the month. We're going to be at Black SEL. I'm going to be doing a health panel there. What else am I doing? Miss Sharon has a book signing here in Durham. And October 1st, the launch of the tickets for New Year, New You. Love you guys. Be safe. DM, text, schedule a consult if you want to talk about your own personal lifestyle and wellness journey. And I will see you next Monday. Bye. Hey, good afternoon.